If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Welcome to Ask the Doctor. This is our 12th season, and it's great to be with you today. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we are here to bring you timely health discussions. For those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line. That's 718-499-6101. Or, secondly, you can do this. This is new now. You can email us actually during the show and get your questions on during the show. You can even make comments about the show that we'll repeat some of them on the air. And you can get through at askthedoctor@netny.net. So we'll look forward to hearing from you by email. Last week we got a lot of emails. Now, we have a great episode here for you. Next to me is Dr. Marguerite Cassina, geriatric medicine attending at the New York Methodist Hospital. Next to her is Dr. Robert Seminara, breast disease specialist at New York Methodist Hospital. Then we have Dr. Lawrence Stamm, nephrology, hypertension, and kidney disease physician at the New York Methodist Hospital. I want to welcome everybody to the show. Thanks a lot. We have a great panel. Been here several times before, and I know that everybody's looking forward to getting their questions in and hearing you. So thanks for being here. Thank you. In the news, it was kind of a slow week, but there were a couple of interesting stories. One this is Children's Obesity Month. And one story came out about a virus, a regular cold virus that infects children and causes their fat cells to mature at a much more rapid rate. As a result, they become obese, and they become obese into adulthood. We're not sure how many kids this is affecting, but it might be an interesting thing, number one, that we make fun. A lot of times the kids are made fun of or they're ridiculed for being overweight, and they may not have any choice in the matter. This virus is causing them to become obese. How prevalent it is, we don't know, but if we do find out the mechanism, we can perhaps undo the damage that this virus is doing to the people. So it's an interesting thing, the fat virus. Now, a new drug for diabetes, LSF, it's called lisofilene. It works in an interesting way. It seems fat in type 2 diabetics prevents the insulin from working properly, and therefore you get diabetes. This medication now prevents the buildup of some of the toxic fatty materials that are stored within the fat. And if these don't accumulate, then the insulin can work properly. They've had tremendous results. It's now in a phase 2 portion of the experiment, and it could be ready maybe within the next year, so in a year down the road. So it's something to keep your eye on. LSF is the name of the drug, and these trials are going on right now. Now, as we said before, September actually is Children's Obesity Month. And again, we're trying to draw attention to the problem that about 60% of our kids are overweight or obese, which is a big problem, big epidemic. Why does this happen? Video games, TV, and fast food. And I know when many of the people out there were young, they weren't playing video games. They were out there in the street, and they had a ball that they knew, and they were playing games. And I thought it would be interesting to talk about some of the games that were out there. And I'm looking forward, when you guys call in for the call, let us know about some of the games that you played, because I don't know where it switched, why the kids stopped enjoying it. But I mean, I'm stickball and punchball out on the street, the Spalding. I even have a picture of it, Spald. If you look over there, remember that thing? So this was a big part of our, Dr. Stamm says, Ringolevio, which I never could figure. It's like a hunter and a hunty.
Right, and there's a song associated with it. Ringolevio 1, 2, 3, 1, 2, 3, 1, 2, 3. Perhaps some of our viewers also remember that game.
Yeah,
Stickball was the major one, though, in Brooklyn. Sewer to sewer.
I love stickball.
Right, home base.
You played in the street or
in the street? You have to play in the street.
Where'd you play?
Oh, we grew up in Brooklyn, Bensonhurst born, and we played stickball, we played softball, we went to the schoolyard, we played in the street, and we played all day.
There was a game Chinese handball. I have no idea why it's Chinese handball.
I don't know, but it was terrific.
We
played that for hours. A bounce against the wall. It was marvelous.
And there was one variation. If you lost, you had to go up against the wall, and people would take throws at you. And
I remember that.
Yeah, I don't even want to repeat the name of that one, but that was another game that we played out there. What did you play growing up?
I think something similar to what Dr. Seminara played.
Right.
But I do not recall that. What is the last name or the last game that you mentioned?
Oh, Chinese
The
name.
Chinese.
Chinese
This
name,
is this is that game. I do not recall.
But I think the New York kids were so inventive without a lot of
Absolutely.
money, and right? I mean,
Absolutely.
You see a box on the sidewalk, it becomes you can
Box
hit the pen.
ball,
Box
hit
ball.
the penny.
So we want to hear from the viewers
Handball,
out there. And
sure.
maybe we can get the kids back into this type of thing, get them out on the street where your mother had to call you because you didn't want to come up for supper. Now the kid's lying there on the couch. She doesn't have to stick her head out the window and call, and he has nowhere to go except walk to the table, eat, and go back to the game. So it's something to think about. I thought a new feature of the show now, because there are a lot of myths out there about health. So I thought each week we'd take 4 or 5 myths and dispel them. So, okay, cold weather's on the way. This is a common myth. Does cold weather make you sick? You know, you go out in the cold, you don't wear a jacket, you go out there with your head wet after the shower. Are you going to get sick? No. There's no truth to it. Studies have shown there's no effect. I hate to disappoint the mothers who made everybody feel bad, but probably it is that the cold weather keeps people indoors and they're close quarters, and this is where the virus will spread or a cold will spread because they're in very close quarters. So that's why there's increased colds in the cold weather, but not because the cold makes you sick. Okay, all right, we'll try another one.
Good.
Turkey. You have a big meal at Thanksgiving that's coming up. You feel tired afterwards. It's the tryptophan. It's this chemical in turkey that makes you tired. True or false? Turns out that the amount of tryptophan in turkey is less than in a common hamburger.
So small.
It's too small to make you tired. What makes you tired is you're eating so much food with the chestnuts and everything else and wine. That's why you're feeling tired. So a lot of people hit the tryptophan thing. It's not enough in turkey. All right, now I know people are shaking out there because they believed all these things for so many years. Sugar makes kids hyper. Sugar makes kids hyper. Again, another word, they did a carefully controlled study with placebos where they told half the mothers their kid was getting a sugary drink and gave him water, and the other half that he's getting a sugary drink, they gave him a sugary drink. There was no difference. There was no effect on the sugary drink and making it. It's just, again, it's in the mind of the parents. It's an expectation. So it's not good to have too much sugar, but it doesn't make you hyper. All right, here, we got only 2 more to go.
great.
This is one that maybe interests you. You should have 1 bowel movement a day. Okay, I don't want to get too personal. It's okay. I want to spare you. What do you think about that? 1 a
I think
day.
it's false.
I'll tell you, I can see you.
I'm going to bite.
Okay.
Not necessary.
It's not
Not
necessary.
necessary. You could have 1 a week. Some people will have 1 a week, 1 every
One a
3
week.
days.
One a week. You don't want to be on a transcontinental flight next to that guy, but it's 1 a week. Right.
Not
But
at all.
no.
But everybody is different, and I think everybody's bowel motility is different, and a lot of it depends upon what you're eating, probably.
This is absolutely the correct
That's
answer.
the correct
So
answer.
what's right is right for you. Constipation may be defined as fewer than 3 bowel movements a week. Again, though, as Larry said, you don't know. So enjoy. Okay, next one. Now, this is one. The food hits the floor. You pick it up within 5 seconds. Can you eat that food? Are you going to get sick?
Well, you should be able to.
Yeah.
I think so, but most people will not do that, including
Most people-
myself.
But the people out there, they drop it, they put it in their mouth, they're good.
Right.
Turns out, if you drop it on a carpet, you're probably safe, because carpet
Right.
you don't pick up much. You may pick up fuzz from the carpet or from the dog, but no bacteria, not that many. It's when you drop it on the tile or a hardwood floor that you're prone to pick up food. And they did studies with salmonella where they actually put it on the floor, had people drop potato chips, eat it, and people got sick. So what you want to do is there's no 5-second rule. If it drops on the floor, throw it out. You know, I think that's the best thing. On the carpet, you may be safe, so depends on how good it is. So what do you think about the new segment?
I think it's great.
I think it's great.
I
Good
think it's
new
terrific.
segment, a lot of myths
Very
out there.
refreshing,
Absolutely.
and I think it's great.
I see Monsignor Bennett is applauding the new segment.
good.
Monsignor, it's good to see you. And no myth that Monsignors are every time except for one in the 12-year history of the show. So thanks very much, Monsignor. Okay, now the quiz. They made me work for this, until you get into the final thing. Now, here's the quiz. What is the most common misspelled word in the English language? And this is a problem, right? Because with this computer spell checks and so on, nobody knows how to spell anymore, right?
Absolutely.
Okay? Spell paradigm. Tough one. I'm not sure you could. So, what is the most common misspelled word in the English language? And the puzzle master, I think, gave us a tough one, but I said I would give a little hint because it could take a while. The beginning letter of this word is in the first 5 letters of the alphabet. So it begins with either A, B, C, D, or E. And it's a recent study that came out. Good luck on that one. So what we're going to do is we're going to take a short break, and when we come back, we're going to write to your questions. Don't forget our topics now: geriatric medicine, breast disease, nephrology, hypertension, kidney disease. Now, the number to call is 718-499-6101. Remember, you can also email us. Want to get your questions to Ask the Doctor at netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are geriatric medicine, breast disease, nephrology, hypotension, hypertension, and kidney disease. Now we're going to get some more questions in, but before we meet our panel, I just want to see who the first caller is. There's always like a little contest to see. It could be Joel, it could be Maddie. Let's see who it is this week. Hello, who is this, please?
It's Mrs. Mara.
Mrs. Mara, otherwise known as Maddie. It's good to hear from you.
Yes.
How are you doing tonight? Maddie?
Yes.
How are you doing tonight?
All right.
So we have a hypotension doctor. You know, I know you've been feeling dizzy.
Yeah, I know. I haven't been feeling good, Mike. Since I fell, on my head, I'm still not right.
Well, let's see. Any relation of dizziness and high blood pressure or low blood pressure?
I don't have high blood pressure.
Definitely low blood pressure can commonly cause dizziness. Dizziness can be caused by problems with the inner ear. As we get older, when we get up too rapidly from a seated position, very often we get what is called postural hypotension. Our blood tends to rush to our lower extremities. And that's why it's important as we age not to get up too quickly from bed or from a chair.
Maddie, weren't you getting a little dizzy when you get up quickly?
Yeah. Well, I fell and I hit my head, whatever.
Yeah, so I think that's something to think about. I hope your doctor will check your blood pressure and check when it changes if you from lying down or sitting up to standing.
I don't have high blood pressure.
No, but you had low. I remember several times it may drop low.
Yeah.
Maddie's about 80 years old now.
Oh, God bless her.
Maddie, how old are you now?
I'm going to be 90.
Wow, 90
wonderful.
years old.
Where
Very
did the time
wonderful.
go?
Excellent, Maddie. So Maddie's the most loyal listener. Anybody have any final comments for the dizziness that Maddie's had?
You covered.
One of the things that can be very, very helpful is very often some special handrails and holding areas can be placed, especially in the bathroom, which is a very dangerous place to fall.
Well,
because the
since
hard
I fell,
tiles-
I have that.
Quite a shock to fall.
It's getting better, but I'm not myself anymore.
All right, Maddie. Well,
Get well soon.
get well soon. It's great to hear from you.
Okay.
Take care. Before we go to Jane, I want you to hold on. Let's just meet the panel. Dr. Kutsina, who's no stranger to the panel. How many times now?
I think it's been, fifth time?
Fifth time, wow. And now you do geriatric medicine?
I do geriatric medicine and general medicine. If you are 65 and above, I will strongly encourage you to be active, take charge of your health, and if you have any problem, don't hesitate to speak to your doctor. Because if you're getting old, it does not mean that you have to get sick, weak. You can still enjoy full life and just take advantage of your age.
So you wouldn't take your child to a regular internist, right? You'd want to take them to a pediatrician. So older adults, it makes sense, should go to a geriatric doctor because there are unique problems. And there are people who don't understand them, won't treat them right. So I hope that
that is,
a lot of good questions.
you're absolutely correct.
Dr. Seminara, who I always love his philosophy on breast cancer. It's always such an uplifting talk. And I know that your daughter, how is she doing, Christy?
She's doing very well. She started her residency program.
Wow.
And, she should do terrific.
Where's she working?
Morristown.
Nice place,
Yes.
beautiful place. Not far from the shop, a lot of good shopping.
A lot of good shopping there. I hope she watches her penny book.
So what about breast cancer?
Well, October is Breast Cancer Awareness Month, Dr. Garner, and we know how much the American people get behind Breast Cancer Awareness Month and make very healthy contributions and do the walk, and people are really motivated to fight this dreaded disease. My biggest message tonight, as it's been in the past, is to motivate patients, women mostly, to be proactive about their breast care. It's not enough just to have a periodic mammogram and or sonogram. They need to be involved directly in the care of their breast. Although many advances have been made in breast cancer today, people are still dying in large numbers. People are living longer with breast cancer, but too many people are dying. The other issue that I'd like to talk about briefly would be the fact that in every case, if we lose a patient to breast cancer, it's almost invariably because the surgeons got there a little bit too late. So let's get there early. Entrust the care of your breast to a surgeon who examines the breast. Be proactive. Ask about your mammogram report. Be involved in the decision-making process. And no one will expire or get sick from breast cancer, and that's the goal.
Thank you very much.
Thanks.
A lot of calls will be coming in.
Sure.
Dr. Stam, we had you on the last show. I know your book is amazing. Could you show that book again? Because that's 100 questions you always wanted to know about renal dialysis.
100 questions and answers about kidney dialysis.
About kidney dialysis.
It's really for the patient who's beginning dialysis or a family member who will be beginning dialysis.
I know that over almost 100,000 people have this book right now.
Probably a little less, probably about 50,000 people, but we're very proud of it, and it's available from Amazon, Barnes & Nobles, and Borders can be ordered.
This is great, and it's simple.
Over the internet.
It's like this show, you know, it's simple answers, simple to questions. And a lot of times the answers turn people off because they're too hard, they don't understand. And I know you took great pains to write this in layman's terminology.
Well, the most important thing is when a doctor is speaking to a patient that they use a common language, a common vocabulary, because very, very often it's easier to slip into medicalese, and this can be very, very mystifying. And I think pretty much anything can be explained in pure and simple English if the doctor has enough time.
Now, aside from that accomplishment, I know you have two wonderful children.
I do. I have Charles Maurice, and he's a junior at college, and I'm especially.
Where's he?
He's at Columbia College in
Beautiful.
New York. And I'm
Did you go to Columbia?
I did. You have a great
look
memory.
at that. They followed. I remember that. Yeah,
So I'm especially proud of him, and my wonderful daughter Elizabeth, who was just accepted to the chamber choir in her high school, Horace Mann. So we're really proud of my kids.
Fantastic. So there you have. This is the show. I mean, you can't get any better than this. I'm excited here, and I just want to. Let's get right to the calls, actually. Sure. I don't even want to take a break. I want to see what's going on. So I see Jane's been waiting patiently. Hi, Jane.
Hi, how you doing?
Hi, where are you calling from?
Middle Village, Queens.
So, Jane, where did you grow up in Queens?
I grew up in Astoria.
You grew up in Astoria?
Yeah.
So what did you play out there? What was your favorite game as a kid? Did you play that hopscotch? What'd you do?
Hopscotch.
You like that?
Yeah, and hide and seek.
Oh, sort of like Ringalivio hide and seek, or no?
A little different, but a wonderful game.
Just regular hide and seek.
And what about that chalk? I used to write all over the sidewalk.
Oh, yeah.
You used to write things like somebody in love or something with a little heart? I know. So
no,
anyway, those days are gone, I guess, huh?
Oh, yeah. I don't know if you remember me with the bloating.
Yes, I do.
Okay, well, you know what the problem is? Gastroparesis.
Right. Excellent.
Malabsorption.
Are you a diabetic?
Yes, but listen, my A1C is 5.3.
Wow. That's a great...
So how do I have gastroparesis?
Well, I guess you can get... Are you taking just diet, or are you taking pills?
No, I take Glumetza twice a day. It's a long extended metformin.
That's it. That's why. So it's just metformin. You know, unfortunately, it seems that your diabetes is under excellent control. However, it is still possible that you may still have gastroparesis. Unfortunately, there is no great medication to treat that gastroparesis. And after you discuss it with your primary care doctor or the gastroenterologist, you'll be able to come up with some way of dealing with this. What are you doing right now about your gastroparesis?
Well, the doctor said I can't take Reglan because I have an empty cellar.
Exactly, and you have to be very careful with Reglan because it unfortunately has very important side effects, something that is called tardive dyskinesia, and it's irreversible even though you stop the medicine. So that's why Reglan is definitely not a great medication to take.
So he said to eat 6 small meals a day.
Correct, yeah, and you eat frequently small portions, and you eat the food that you're able to tolerate. And it seems that you're doing very well working with your doctors.
The only problem now is I have a left pleural effusion.
Mm-hmm.
And it's very unexplained. Nobody knows what it's from. I've seen the pulmonologists. They did that thesis thing where they take the needle and stick it in your back.
Mm-hmm.
And they took the fluid out, and it was clear. There was no malignancy there, nothing. And they just can't explain why I have that. They think it's from the diabetic medication that I used to take.
What
Amaryl.
medication did you take prior?
Amaryl.
Amaryl?
Right.
Honestly, the most important thing is to exclude all other associated conditions. I think the great step was to testing the fluid that has been accumulated in your in the pleural cavity. The other potential explanation is maybe some kind of conditions or diseases in your abdominal cavity. So they will have to look maybe at the pancreas. And,
no, they did that.
Mm-hmm.
They did all that and nothing.
Let me ask Dr. Stam, any thoughts for isolated left pleural effusion?
I
It's
think
fluid in the lung. It's basically fluid in the lining.
I think it's wonderful that they haven't found anything bad.
Right.
And I think it has to be watched. It has to be, observed. And there are cases where people have pleural effusions that are hard to diagnose.
Sometimes
There are
they
many
occur
diseases that
with
can
women.
cause
With
them.
women, tumors of the ovaries, uterus, some of those can occur, and also arthritis. Certain arthritis conditions can produce.
Lupus would be one of
Lupus,
those
right.
things.
So, I mean,
Right.
it's an interesting case. It's something, though, that we're glad that they haven't found cancer, and we hope
And
you
now
can.
now my problem is my potassium is very high.
Dr. Stam must see,
Your
must see,
calcium?
his calcium.
No, Potassium.
Potassium is a
Potassium.
very commonly elevated element in our blood in patients with diabetes, and sometimes they make a little less of a hormone called renin in the diabetic kidney. This might be something that's going on in your case, and the hallmark of trying to face this is to eat less potassium in your food, because the less you eat, the less your body has to excrete.
Such as?
Bananas, oranges, believe it or not, cantaloupe has a lot of potassium in it, chocolate, nuts. Salt substitutes are not very good because a lot of them have potassium in them.
So, Jane, you got a lot going on, but a lot of good stuff we hear tonight. And can you call us back later on in the month?
Yeah, well, I told you I lost 85 pounds, so
Wow, this is amazing.
I think that's great.
So
it is.
we look forward to hearing from you soon, okay?
All right, have a good day.
Take care, Jane. You too.
Bye-bye.
We now have Grace. Hi, Grace.
Yes, hi there.
Where are you calling us from?
East Flatbush.
Yes. Did you call us last couple?
Yes, I was the one that went to the hospital and they found I had musculoskeletal chest pain.
Weren't you at the Kings Plaza Diner?
Yes, that's correct.
Yeah,
And I
she
didn't
was-
feel good, and I made him take me to Kings Highway Beth Israel Hospital. Yeah.
But the question, Grace
Yeah,
Grace
and,
was eating in the diner and had some costochondritis, and she went there, and luckily it wasn't the heart. And Grace is also. Are you in your Grace is beautiful, right? So Grace, what did you used to play growing up?
Well, I'm 75, and in Erasmus High School, I used to love volleyball.
Oh,
Volleyball.
volleyball. That was more of an organized sport. A lot of famous people went to Erasmus High School.
Oh, yes, I know that.
Who was it? Barbra Streisand?
Barbra Streisand?
And Jeff Chandler, I believe, too.
Chandler.
Yeah, that was a great school. I think isn't that the oldest high school in America?
Yes, it is.
Yeah. Are you feeling okay this week?
Well, I started in again, and it said, call your medical doctor on the paper from the hospital, so I did, and he put me on Sulindac twice a day for 5 days, and thank God it subsided. Now, once in a while I feel a strange little ache, and I call my doctor. He says, when he gave me 2 years ago, when he went to this new doctor, he gave me a good physical, and he found that I had arthritis under my breast, my left breast, like in the rib. He said I have arthritis. So,
Okay.
can I expect pains in that area to come back again?
Well, yeah. I mean, you've got an arthritis, Dr.
Sure.
Seminara.
Sure, absolutely. Arthritis can occur in the rib cage underneath the breasts, and if the breasts are heavy, that could exacerbate that, make that worse.
I'm very big on top. I'm a 42 double D.
Well, that's big enough to give you pain, especially if you got arthritis. You should be wearing a bra that gives you plenty of support, even a support bra, something that's not too tight, but it'll keep you snug, and maybe that pain will get better.
But a lot of times people think they're getting a heart attack, and you
Exactly.
don't want to second guess. If you feel chest pain, You go right to the hospital, let them
Always.
decide that. I remember Grace was eating at the diner and came over. Incidentally, that's a great, has anybody been at the Kings Plaza Diner?
Sure I have.
That is a great place.
Very good diner.
For $25, you get like 20 courses and a $3 glass of wine.
Very good.
You ever have a $3 glass of wine?
I have.
I'm sick. Yeah.
Do you have anything to do with the puzzle yet? I didn't hear anything about a puzzle.
Oh, there's a puzzle,
The puzzle.
Grace. You didn't hear? Yeah. The puzzle is, what is the most commonly misspelled word in the English language?
What's that?
The most common word that's misspelled in the English language.
Misspelled in the
So you think about it. If you come up with the answer, call us back. Okay?
Okay.
Thanks, Grace.
Thanks.
Now let's go to Anthony. Hi, Anthony.
Hey, Doc, how are you?
How you doing?
Good.
Where are you calling us from?
Middle Village, Queens.
Did you grow up there?
I'm sorry?
Did you grow up out there?
No, Greenpoint, Brooklyn.
Greenpoint. So what you used to play out in Greenpoint?
Softball.
Oh, really? In the street or in the schoolyard?
In the schoolyards.
So you weren't playing any hit the penny or punch ball or any of that stuff?
Oh, punch ball. Every kid plays punch ball, yeah.
Yeah. How did you hit it? Underhand or overhand?
Underhand, arc. 6 to 12 arc.
Okay.
Yeah.
Spalding or a Penzi Pinky?
Spalding.
Spalding, yeah.
Yeah, good.
It was a great days. Those were great days.
Sure is.
What can we do for you?
Actually, I'm calling in about a relative who is around 50, 52 years old, who lost his pancreas, bad diabetes. Now went in for dialysis, was released after a month in the hospital in Albany with dialysis, completely swelled up, can't walk anymore, and he's in really bad shape. So I'm wondering if the dialysis is not working properly. He's supposedly going 3 times a week.
Dr. Stam.
Well, that's an excellent question. And we know that the kidney works 7 days a week, 24 hours, 168 hours a week. And in many, many people, it's very, very hard to replicate kidney function with just 3 times a week. The most important thing is the patient getting a long enough treatment? That's very, very important. Maybe the length of the treatment has to be a little longer. And I would always ask the physician, is it possible to sign up for an extra treatment to get some of the fluid off? And very, very often when people are very, very fluid overloaded or they're beginning dialysis and they have so much poisons in them, they may need a little more dialysis than just 3 times a week.
Okay.
So he was up in Albany?
He's up in Albany, yeah.
Is he coming down here or he's staying up there?
I think he's staying up there because he can't even move at this point.
Albany has good doctors.
If you ever need a consult, if he comes down here, you'll give him Dr. Stam. Maybe you'll, talk a little bit and see what we can do.
Thank you so much, guys.
Take care, Anthony. Good to hear from you. We're now going to, I don't know if this is the Larry. There's a Larry that calls this show from Rockland County on a regular basis, and there we're only on the internet. And he's one of our most loyal listeners. I got to see if this is him. Hello?
Hello, Dr. Garner. How are you?
Is this Larry from Rockland County?
This is Larry from Rockland County.
This is amazing. One of our, you've heard him before.
I have.
Always with a good question.
Well, I hope that it can be answered. Maybe perhaps Dr. Kotsinia or Dr. Stam might be able to tell me. We have a friend who went into the hospital with a pneumonia, and while there, she went into an arrhythmic condition, and they spoke to her that they said they may have to do an ablation, and what is the difference between an ablation and a pacemaker?
Well, Dr. Kotsinia can start and we'll work around.
Right. All right, so there is a different kind of an arrhythmias. One type of arrhythmia is the heart is beating very fast or irregularly. So that type of arrhythmia, it's called like a supraventricular tachycardia or atrial fibrillation or atrial flutter. And most of the times, those kind of arrhythmias are caused by the area in the heart that generates or produces some extra beats. So in order to control that arrhythmias, that particular area will have to be destroyed or burned. And this is usually accomplished by doing the ablation. There are different kind of arrhythmias when the heart beats very, very slow. And in that case, the doctors, after looking at the patient, because there is different circumstances and different conditions that are associated with that type of arrhythmias. So maybe there are some medications causing the heart to beat slow. And after that, all these causes are excluded, or the medication that can potentially cause that slow heartbeat is stopped, the doctors can consider the pacemaker. So this is a device that generates the heartbeat. So now, do you have, Larry, any more questions? There anything, because there is so many things that you can talk about regarding that pacemakers and ablation and arrhythmias. Is there anything else that you would like to ask?
Well, I was primarily concerned about that because they said they have to do a surgical procedure in order to do this ablation. And, it would appear to me I had a cardiac problem, and they gave me some pills. I had an arrhythmia, and they gave me some pills after I had heart surgery.
I see.
So I couldn't understand what, why they would have to do something like this, or, at the very least, a pacemaker seemed to be
I mean, it all depends on what kind of arrhythmias does the patient have. There are specially trained doctors who specialize in dealing with arrhythmias. So they do the pacemakers, they do the ablation, and I'm sure if it's all possible, the first step is always the medication. And if at all possible, you try to avoid any intervention. So I think at the end, it all comes down to the specific types of arrhythmias that the patient has.
Well, Larry, hang on. There's Larry.
Yeah.
Larry,
One of the things that I think is important to think about is very, very often when there's a lung problem, a pneumonia, COPD, this can also affect the function of the heart. And it's not uncommon when people have a deterioration in their breathing function, this can set off some of these arrhythmias. And sometimes when they treat the lung successfully, they can sometimes calm down the rapid heart rate. And without a doubt, the EPS or electrophysiology cardiologists are the people who have the most experience, as Dr. Cassina was talking to us about.
Okay. Larry, so where did you used to play growing up? Where did you grow up?
Oh, I grew up in Brooklyn, and we used to play everything that you were discussing. We played stickball, punchball, Johnny on the Pony, 3 feet off to Germany.
What's that one? I don't know that one.
3 feet off to Germany, there'd be a can in the middle of the street. Of course, there were no cars then, so you can play in the middle of the street. And we would, somebody would kick the can and holler 3 feet off to Germany, and everybody would run away, and whoever was closest to the can was it. And I didn't know what being it was, but that was one of the games we used to play.
There's a variation, I don't know if you guys heard it, called Spud, where you throw the ball up in the air and then you catch it, and who's ever closest, you try and throw it, you hit that person and he's out. And you get S-P-U-D. Why Spud? I don't know. But anyways, it's great to hear from you.
My pleasure. Let me ask you, is the word definitely, by the way?
The word is definitely, by the way, but I got to go to our judges and check this out. Now, judges, Larry is making a guess here on the answer to the question, what is the most commonly misspelled word? And what is your guess, Larry?
Definitely.
Definitely. What is it? I'm waiting for our judges.
Oh.
Man, can you imagine if they were like leading the army into battle? This army would be destroyed. I mean, you get this whimper. It's a whimper. Larry, you won this. You actually won the contest.
Did I?
How did you know it?
I hope it was the lottery. I wish it was the lottery.
It's amazing. This is, I think, the second time you've won.
Great. I always misspell it. That's why I know it.
This is a great, and it's for people to think of it. Amazing. Very amazing. You know what was second?
Okay,
no, it's
Doctor,
okay. You get it first. So we're going to take your name off the air, and we're going to send you that hand-embroidered plaque. That's beautiful. Where did you hang the other one?
I hung the other one downstairs where I have a desk, so I put it over there. They don't have to send another one. Save it for someone else.
No. Don't be modest. We like to spread the word to Rockland County. Okay?
Okay.
Thanks a lot.
Thank you very much, Doctor.
So what we're going to do now, we're going to take a short break, and we're going to come back and we're going to talk about breast disease, because I want to hear what's new, what people should be doing about it. So the number to call is 718-499-6101. And our topics are going to be nephrology, blood pressure problems, geriatric problems, breast problems, and surgery. You can also do general surgery problems. So we'll take a short break, and we look forward to seeing you soon. Remember, the number is 718-499-6101. The email, I got to throw that in, is askthedoctor@netny.net. Take care. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where we have Dr. Larry Stamm, who's our nephrologist, kidney disease specialist, high blood pressure specialist. I have Dr. Margaret Katsina, a geriatric medicine attending, who takes care of the elderly and people who are above 65, I think.
Yes.
And Dr. Robert Seminara, a breast cancer and surgical specialist. And as I said, we have a new feature tonight, the emails. And we do have a question, so I'd like to bring this up and see. It happens to be a mammography breast question. Okay. I had a mammography, it says, and they don't want me to get it too soon, you know. They had a mammography and they found something. A biopsy was done and they left a clip in the breast. Okay, what do you think? Why did they leave a clip in the breast? The biopsy was done. What do you think about this?
Well, first of all, it's very important that the doctors explain to you everything they're doing. And this is one of the new things I was going to speak to you about today so that the people at home understand that. Regarding the breast, there's a lot of work being done under the name of less invasive surgery. Mm-hmm. A lot of new stuff has been developed so that women, in order to explore an abnormal finding, either in a mammogram, in a sonogram, or in a physical examination for that matter, without having to be cut, without having to have an incision. So this is lesser invasive, and when it comes to breast, this field is getting bigger and better too. So in this case, it sounds like something was found either in a mammogram or a sonogram, Dr. Gardner, and a biopsy was taken. A biopsy was taken usually by giving some local anesthesia, making a very small nick in the skin, and a biopsy instrument, an instrument that looks like a little bit larger needle, is inserted, usually painless, and a biopsy, a piece, not the whole thing, but a piece of that funny or suspicious or funky looking thing was taken out and sent to the laboratory. But in order to remember exactly where that spot is, we need to put in a marker. A clip is what's used today. And the clips that are used, and I'm glad the viewer at home sent this in, because I also hear of many questions where these clips can be dangerous and the clips can cause infection and the clips can travel and go places to your heart and your lungs and hurt you. The answer is that the clips that are used today are very uninvasive, cannot travel and go anywhere, and will not hurt anyone. It's used to identify that spot so that in case we do find something abnormal, the surgeon's got to go to that spot and remove just that area. There will be no other way to identify that spot without a clip. But these clips are safe, and the whole procedure should be done very, very safely, and it's very important that you, the patient, ask questions about this. All of this is outpatient. Many of these are done in the doctor's office. In my case, we like to do this by giving some sedation to the patient, so the anxiety is truly arrested, and patients are very grateful for that. But you should ask questions, and that's the reason they left that in there.
Excellent.
Okay.
Let's go to Cliff. Ron, I'm sorry we cut you off, but why don't you call back and we'll get to you. We're now going to go. Hi, how are you?
All right, thank you.
Right, who is this, please?
My name is Cliff.
Cliff, how are you doing?
I'm doing all right.
Where did you grow up, Cliff?
Beg your pardon?
Where did you grow up? Which part?
I grew up in Flushing, New York City.
What did you used to like to do when you were a kid? What did you play? What kind of games?
Oh, every single game that was in existence where we all played.
What was your favorite?
Handball.
Handball. Against the wall? One wall?
Yeah, single wall.
Did you ever go to the championship they used to have at Coney Island?
No, but I've heard about it. I've heard about the ones down in the village, too.
Yeah, amazing players.
Still have it.
Is it a black ball?
Still
What do you
have
play
it.
with that?
They don't use a black ball
mostly
anymore. They use another
Spalding.
kind of ball.
Usually Spalding.
Spalding. That doesn't. The black ball looked like it would hurt your hand,
A
no?
little smaller.
Well, sometimes
Yeah,
we
use a
were, if
different
we
one.
used a black ball, we would use a glove, or if
Yeah,
we didn't have
glove.
a glove, they would tough it out.
Tough it out, Cliff. What can we do for you tonight?
Well, I was wondering why I can't sleep. At the begin, when I lie down in bed, I have a very anxious feeling. That will go on for half the night before I can get to sleep.
How old are you, Cliff?
81.
Wow, sound very young.
Well, I feel young.
Are you overweight at all?
No, I'm a normal weight.
Okay. Any medications?
Heart medication.
Okay, so we have Cliff who has trouble lying down at night. He's on heart medications. What do you guys think?
I mean, it's a very problem sleeping, and particularly in someone who is in the 80s, it's a very tough problem to deal with. There is a couple of things that can help you. One is you'll just have to identify what exactly that anxious feeling is. Sometimes people feel short of breath when they lie down, and it's experienced as the anxious feeling. Sometimes they can experience palpitations or heart racing, and it also will give you that anxious feeling. Do you have any of those?
Do I have any what?
Any of those symptoms that I've just mentioned? You know, the palpitations, shortness of breath?
No, I don't.
None of it. Okay, and what kind of medications are you taking?
Simvastatin,
Uh-huh.
HCTZ.
It's a water pill, right? It's
Yes,
also
a
can
water
cause
pill.
if you have to get up to go to the bathroom at night, it will not help your sleep either. And any other medications?
Yes, just one moment, please.
See, it's amazing. All of our callers should really know their medications. You're taking medication. I think it's important to make sure, number one, you tell the pharmacist, you tell people what you're taking. So, Cliff,
Yes.
what's the other medication?
Let's see, Metropolo
Metoprolol. Okay.
and amlodipine.
Okay, so apparently this is medications for the high blood pressure and
That's
high
right.
and high cholesterol. If you do you snore if you fall asleep eventually?
Eventually, about 3 o'clock in the morning.
I see. So the first step is to exclude all medical problems that causing your trouble sleeping. Secondly, what you do is you explore something that we call sleep hygiene. So you make sure that you go to sleep at certain time. You only go to sleep if you feel sleepy. Don't go to sleep because you feel it's 9 o'clock and it's time for you to go to sleep.
Well, I usually go to sleep about 11:30.
Okay, but even now, if you don't feel sleepy, you don't feel like you want to sleep at 11:30, don't go to sleep. Just
Okay.
read or you can watch TV.
Cliff?
You should only use your bedroom only for sleep. Don't
Right.
watch TV, don't read, and try to calm down. Nothing exciting, no exercise. Try to calm down just before that sleep time. And if none of it help, then you can discuss with your doctor any other medications maybe to be used as a sleeping aid. However, I would strongly discourage you from doing that because when it comes to the elderly people, they're very, very sensitive to all the sleeping medications. And please do not use any over-the-counter sleeping aids.
Well, I tried Ambien last night, and I had a very bad reaction. So I'm not going to avoid that.
Exactly. So it's a very tough problem to treat, and you have to definitely speak to your doctor and be very careful with over-the-counter or herbal medications or supplements for your sleeping
That
problems.
Ambien's tricky because
tricky.
sleepwalking, people go sleep eating.
Sure.
and
Right, right.
One very, very important thing is to limit the amount of caffeine and caffeine-containing beverages. A good rule is after 12 noon, no caffeinated beverages, no colas, no tea, no coffee, and this can cause both anxiety and difficulty sleeping.
What about
It's the
chocolate?
thing.
Does chocolate have enough caffeine?
I think it does also.
Yeah.
Yes,
That's a
it
good
has
point.
caffeine.
Chocolate does.
Very good. Cliff, great to
Yeah.
have you as a listener.
Thank you very much.
Take care.
It just happened to be a first time. Well, I was surfing the television, and I happened to come upon your show. It's very interesting, and congratulations.
That's why I have Dr. Katsina here. When they're searching, they see her, they stay on the line.
right.
Otherwise, okay.
I see her on television right now.
I know you, Cliff. Thank you, Cliff. Take care.
Okay.
Let's go now to Ron. Hey, Ron.
Yeah.
Ron, we almost lost you. What happened?
I waited so long.
You got fed up, huh?
Yeah.
I know. So where are you calling from?
Yeah, I'm calling from the West Village, Greenwich Village.
Very nice. Where did you grow up?
I grew up in New Jersey, in Glenridge.
What did they do in Jersey to play? Did they play stickball and box ball and punch ball out there?
To tell you the truth, if they did, I really wasn't. You know, kids play all of those games. Those games are sort of, played probably on every street in New York City and New Jersey.
So let me ask you, Ron, what do you like to eat out there? You ever go to the Blue Ribbon out there on Bedford Street?
No, it's not the Blue Ribbon, I don't think, isn't it? It's the Blue something, but I don't think it's the Blue Ribbon.
Blue Ribbon.
No, I haven't, Doctor.
Great place.
Right,
you love that place. Open till 3 in the morning there.
Oh, really?
Beautiful branch in Brooklyn, in Park Slope.
Well, that's a good...
We help you out, right?
Yeah.
That's what I mean. Okay. What can we do?
Yeah, what I have a question, and I also have a comment. I have neuropathy, and, I've had the whole menu when it comes to neuropathy. I've had the freezing and the burning and the electric shocks that you get, and my comment is that there's so little known about neuropathy. And I have a doctor, and I'm treated for it, and mainly I'm on pain medication, and I wonder if why isn't there any? I don't know. Nobody seems to know anything about.
Ron, I got people here that know. Let me get right to the panel because we only have a few minutes left in the show.
Okay.
Larry, the neuropathy.
We're making tremendous strides in neuropathy. Specifically, there are diagnostic tests that can indicate what kind of neuropathy it might be. And sometimes, in very, very difficult cases, a nerve biopsy, a sural nerve biopsy can be done to try to identify the cause of neuropathy. Sometimes people have neuropathy from diabetes, from a pinched nerve. There are many, many different causes. But in order to really get to the bottom of things, they have to come up with a specific diagnosis. And if the diagnosis cannot be made, sometimes medicine is our only resort, but it is a challenging problem.
Dr. Katsina?
Yeah, I think that's you pretty much covered it all, and it's very important to identify the cause of the neuropathy, because a lot of times the neuropathy is secondary to some other primary condition. So if that condition is identified, so the doctors are able to treat that condition, and hopefully it will help the neuropathy. But if not, then pain medications, physical therapy, exercise, maybe acupuncture to some point. But I think it's a very, very, very tough problem.
Ron, thanks. Is it your first time watching the show?
No, I often tune in to your show, Doctor.
So I hope we helped you with that. It's a tough topic, probably not related to your food intake, although people may talk about vitamins and so on.
Right, yeah.
Does our surgeon have any thought on that, Dr.
Well,
Seminara?
I think our panelists have covered that very, very well. But I think one thing for patients to understand when it comes to neuropathy is don't quit. In other words, there may be numbers of reasons for this neuropathy or the pain or the problem. And as we get older, more and more of that occurs because our bones change and we all become arthritic to some degree after 40. So don't quit. Don't quit trying. Different kinds of athletic postures and strengthening muscles in other parts of the body might help this. Just don't give up and don't quit and say, well, I have neuropathy, it's over. Keep working, keep moving, and make yourself better.
Ron, I hope you enjoy. We go into Blue Ribbon. Ask for Andrew. Tell him I said hello.
Okay. I just also wanted to say that, as I said, I live in the West Village, and walking really helps. I have walked from Greenwich Street to the Brooklyn Bridge, over the Brooklyn Bridge,
great.
and I just don't give up. I just keep
That's
on
great.
walking.
That's it. That's
Ron,
the
give us a
answer.
call back, okay?
Okay. Good luck to all of you.
Thanks a lot. Take care.
thank
We've
you.
got so many callers. I'm going to try and, move along a little bit faster here, but we have an email that I must get to. I've been diagnosed with pericardiac tamponade, or we call it cardiac tamponade. But there's a little fluid in his pericardium, which is the lining covering the heart. So we have this fluid, and the heart's bumping, and there's fluid out here. Can this condition cause a rapid heartbeat? Alan wants to know. Can cardiac tamponade cause a rapid heartbeat where the heart is getting constricted by fluid?
So most of the times, pericardiac tamponade is a very dangerous condition. So it's basically considered a medical emergency. So pericardiac tamponade means that the heart is not able to work properly, and so it definitely will have to be treated as soon as possible. Now, most of the times is associated with a large amount of fluid in the pericardium. So that part is not very clear to me. However, just to answer to your question, can that condition cause tachycardia? Absolutely, yes.
And Dr. Stam, I know must see a lot. You must see patients with buildup of fluid.
We do, and very, very often they can be successfully treated by putting a small catheter in to remove the fluid, and sometimes a surgical procedure can be done to help out. Small amounts of fluid can sometimes be watched over a period of time, and there are conditions that can cause this fluid, and it's important to try to think of those conditions and
See, I
try
love
to
this
treat
panel
them.
because the panel answers in such clear, concise terminology. And if you look at the other shows, go to Fox on Sunday morning, they get the questions on Wednesday, because I know, because I'm there. We get the questions now, so I really appreciate this. I'm going to go to Sandra. Hi, Sandra. Sandra,
Hi,
how are you?
fine.
Where'd you grow up?
In Trinidad.
Trinidad. What, did they play with the ball out there, throw the ball around or anything, the girls, or play hopscotch?
No,
No. So what'd you do for fun?
nothing. Who I'm speaking to?
Oh,
Who's speaking to Dr.
Okay. What my problem is,
okay.
my foot, it is swollen most of the time, and in the night time it just goes down. In the morning it gets swollen.
Okay, what gets swollen?
My feet.
Okay, the feet get swollen in the morning.
Yeah.
Okay, you wake up with swollen feet in the morning.
No, it is gone. It's down, right down, like a normal feet. But then as soon as I start walking, it's swollen again.
Okay, Dr. Stam,
Yeah.
we got about 30 seconds.
In general, the first thing that I would do if you have swollen feet is to try to decrease the amount of salt that you're taking in your body and see if that helps a little bit. Definitely mention it to your doctor because there can be a lot of different causes for swelling feet.
See, I feel, Sandra, I'm sorry we had to rush that, but we're going to get back and find out what kind of fun you had in Trinidad growing up, okay?
Okay.
Thanks a lot. I'm sorry we're leaving some of the callers over. That happens. And also, I didn't get enough to Dr. Seminaro, who I wanted more, but to give a quick last message. We got 30 seconds.
Well, the idea and what I had said before is this: be proactive about your health, especially when it comes to breast. October is Breast Cancer Awareness Month.
Where can
Ask
they see
questions.
you? Where can they see you?
My office is in Bay Ridge, and I do surgery also in an ambulatory center as well as Methodist Hospital.
Excellent. And Dr.
But
Stam,
be proactive and ask questions.
Proactive, ask questions. Probably not just for breast, but for any of the disease. Dr.
Right.
Katsina, you can
Yes,
be...
absolutely. Ask questions, speak to your doctor. If you're not clear about anything, you're not sure what medications to take, on what it's for, do not hesitate, and please speak to your doctor.
Yeah, and that's it for this episode. I mean, we need another half hour here, but I want to thank Dr. Katsina, Dr. Seminara, and Dr. Stam for coming in. We will hope that we were able to help you. Now remember, as we just said, you should be proactive about your health. Speak to your doctors about your concerns. Go for second, go for third opinions. And we're going to see you again next week. We have an interesting show. We'll have a special guest from Calvary Hospital to talk about palliative care. You've seen their commercials, actually good commercials. A great center. And we're also going to discuss cardiology and head and neck surgery. Also, we'll get into your sinuses, any things you got like that. In the meantime, visit our website at netny.net/askthedoctor. And here you can see video blogs, you can see the tablet column, podcast, forum. You go crazy there. Now, the other thing, you can watch past episodes tonight at 10 p.m. You should be watching that. You're going to rush home to see that one, actually. Mm-hmm. And every morning at 10 a.m. And how can I not thank Linda Lapatosa, the Quizmaster, for all her work. I want to thank you for all your questions. Say goodbye. Be healthy, safe, have a great week, and I'll see you in the tablet.